I'm Dr. Shaw, and in my practice, I care for mothers with young children. Yesterday in particular, I had a very typical kind of day in the clinic. A mother came in with her young infant. She was 3 months old, and on top of not wanting to take a bottle, she was now refusing to breastfeed. Mom has taken baby to the pediatrician. They can't figure out what's going on. There's no tongue tie. They don't know. This baby's just uncomfortable. And she said, you know, I met you once at a group. You said something about breastfeeding. So I thought, I'll just bring them in, see if there's anything you can do to help, because the pediatrician isn't helping, lactation consultants aren't helping. I don't know what else to do. So she brings her beautiful baby in, such a playful little baby, oh my gosh. And it took me right back to one of my own low points. So shortly after my son was born, he was losing weight, weigh in after weigh in after weigh in. And if you've ever had a young child, you start going, I don't know what's wrong, but there has to be a way to change this. So, whew. After our third failed weigh-in, my sleep-deprived mom brain finally took a break. Silence. And there I am, holding my beautiful baby boy, and my clinician brain clicks on. And I'm on maternity leave, so it's been off for a while, okay? But I'm trained to take care of babies. I'm trained as a chiropractor and a naturopath to be able to assess what's happening. So I sit down with him, and he's asleep, and I'm just staring at him, and I'm like, okay, nobody else has figured out what's wrong. What are we gonna do? Let me show you a picture of him that really illustrates what's happening. So, it's one of my favorite pictures of Charlie. This is my little one, okay? Right around this time. There are things that I started noticing as a doctor. So as a mom, I'm like, oh, he's beautiful. What's wrong with him? Nothing. But as a clinician, he's wearing a hat, which is the first thing. Babies who are wearing hats, unless it's super cold, typically means they've got a lumpy head. So take that off, look at his head. It is not smooth. We had a really hard labor. He was lumpy bumpy, which as a chiropractor, I know I need to fix. Then if you look at this picture, his nose is tilted. That's because his head is also tilted. And he was like this a lot, especially when he would fall asleep, okay? He has one eye that's smaller than the other. That's another thing. His tongue does not stick out in the middle, which is totally why he can't breastfeed well. I am in pain because he can't breastfeed, he can't latch on. So, back to mom holding baby. So I'm sitting there and my doctor brain clicks on and I start going, okay, these are things I know how to fix. So I ever so gently start working on his cranium, so his skull, and all those lumpy bumps. And I start feeling where the shifts need to happen, and where he's at ease and where he's not. And I start feeling his little tiny spine. I start going, oh man, yep, that needs a correction, that needs a correction. And I start holding it. And it's so gentle. He's still asleep. He's sleeping through this whole thing. So I'm going in, well, that's been in there a while. Okay. And I start to think, I wonder if that's really doing enough. And before that thought is done, he opens his beautiful blue eyes, his little dandelion hair everywhere, and he looks at me as if it's the first time we've ever met, okay? And he's weeks old at this point. And I look at him and I'm like, well, that did something. He's definitely looking at the world differently. And he gives his little hungry squawk. And I'm like, all right, moment of truth, here we go, let's try this. And so I go to latch him on, right? Belly to belly, I'm doing all the things lactation consultant told me to do. And it doesn't hurt. This is ridiculous. This is all it took? Are you serious? And I'm going, this is a placebo. It's just because I want it to be this way. This isn't the truth, right? This can't possibly have worked that fast. So over the weeks and months, I keep checking him. He keeps growing. And every time his midwife starts going, he is just gaining weight like a champ. This kid is amazing. And I'm like, this mom is amazing. Like, this mom figured it out. So I could look at my breast pump and be like, you'll get your moment some other time. I don't need you. This baby is able to breastfeed efficiently, right? So now, every day in clinic, I get to help other moms. So this mom who came in yesterday, same thing happened. I adjusted her baby after her not being able to form a good seal. She's uncomfortable, she kind of cries when she sucks on anything, pacifier, bottle, nipple, anything. And mom, before she leaves the office, latches her on, and she goes, this is crazy. Are you serious? And I said, yeah, I did mention that thing about breastfeeding. And when our bodies are in alignment, that baby can open their mouth wide. And she goes, oh, man, that makes so much sense. And so now, Shaw Family Practice is here to help other mothers harness the power of motherhood. So if you know a mom who's struggling, if you know anyone with young children who are starting to have failure to thrive or ear infections, digestive issues, there's a place that can help. So I'm here for that.